Hi everyone, my name is Molly. I'm a patient care coordinator at Sam Plastic Surgery. Today we're diving into the world of lip enhancements, focusing on three popular procedures that we offer: a lip flip, filler, and a lip lift. Each of these methods are a unique way to enhance your lips, so let's break it down. So what exactly is a lip flip? This procedure involves using Botox injectables to relax the muscles on the upper lip. It's a quick, non-invasive treatment that helps create fuller appearances without adding volume. The procedure is straightforward. It's just four small injectables strategically placed to flip the lip upwards slightly. The beauty of a lip flip is that it provides a subtle enhancement and is a great option for people with a gummy smile. Some key benefits of a lip flip include a low commitment change lasting about 2 to 3 months. This is a no downtime procedure offering a more natural look without the added volume and could be the perfect option for you.
Lip filler is a refined hyaluronic acid. So the goal of that product is to build volume and shape to the lips. So naturally, as we all age, we lose hyaluronic acid, collagen, elastin, all these support molecules in our skin and our lips, even your nails, your hair, all that kind of stuff. It's just a natural part of aging. Hyaluronic acid as a purified compound was created and made into filler. So you can use filler all over in the face, but today we're going to talk about lip filler. Lip filler is specifically designed to move a little bit more with your mouth because as you're watching me talk, my lips are moving constantly. So we wouldn't want to put a hard, stiff, supportive compound in there because that wouldn't move or look as natural. This type of filler for the lip was created to be more flexible, to give more volume to something, and to recreate that younger, youthful looking lip shape or volume. So sometimes you lose a little bit of both, and some people are just looking to have fuller lips. So there are at least, oh my goodness, 7 or 8 different products that we have utilized in Sam Plastic Surgery that are focused for lip rejuvenation. So they can be used to create more shapes. If you have a thin upper lip, we can use a stronger compound that might have a little bit more cohesivity to create a higher profile on your upper lip. Or if you're just have a beautiful shape, but you're like, I've lost some volume over time, then we can put in a product that's really just focused on bringing in volume to the lip so that you feel like it has some of that regeneration to it. So you can use them in multiple different ways, and we definitely try to tailor the product choice to the lip that we're treating so that we can help you achieve the result that you're trying to get. So the process for getting lip filler placed at Sam Plastic Surgery is we usually have a consultation where we work with you to walk through what it's going to look like, if it's a safe treatment for you, and then expectations of what recovery looks like and long-term expectations of how long it might last. So those are all different things to consider. So at Sam Plastic Surgery, we do offer different options for comfort during this procedure. A couple of those are either a topical numbing cream, which does have to sit on the lips for 30 to 60 minutes, depending on the person. So it's a little bit more of an investment of your time. Or we do offer a partial numbing block. Those are injections that go in your mouth but help numb the lip and decrease the sensation so that you wouldn't necessarily feel every single injection as we are putting the filler in the lips. Lips are very sensitive. They have a lot of nerve endings in them for good reasons, right? I mean, you get to experience a lot of things as you're talking, if you're kissing, as you're smiling, all those things. And so we want to help reduce some of that sensation to provide the most comfortable experience possible. After things are all numbed up, we do a really thorough job of cleaning. I use at least 2 to 3 different cleansers to prep the lip for lip injections. And then I like to give that numbing a little bit to set in, and then after that I like to test. So I'll actually come and check your lips to make sure they feel pretty numb before we start doing injections. The actual time of injecting lips can vary quite a bit, but it can be anywhere from 50 to 40 minutes depending on the results we're trying to achieve and how challenging that can be, because everyone's anatomy is a little bit different. So that's the length and breadth of that appointment. It's completely normal for your lips to stay numb for a couple hours after the procedure because the filler itself actually has some numbing mixed in with it. Some people's lips won't feel, they'll notice all the sensation coming back 30 minutes later, and other people it will be a couple of hours. So that's also completely normal to have that variability. It's just based on how people metabolize different medications. So that is the process. Afterwards, we definitely send you home with some ice. We do put topical arnica on and maybe some oral arnica as well to try and decrease any possibility of bruising. Helps a little bit with swelling, but more with the bruising. Definitely, you're going to notice immediately some results. There will be swelling afterwards. That's incredibly common. The lips are very sensitive, but you will be able to see a difference, a visible difference in the shape and volume of your lip after. It does take about 1 to 2 weeks for the swelling to really settle and any possible bruising to subside. And then that shape should become really more apparent, like what the actual change is from the before to the after. We usually see our patients back at 2 weeks just to see if there's any need for a touch-up to make sure the desired results were achieved, and then to make sure that there haven't been any complications from the procedure at that point. It's really fun to see people back and just see how things changed and to be able to appreciate the results that we achieved utilizing the best product for our patients. Filler can last anywhere from 6 months to 12 months is what the FDA approval is for the studies. I've seen it in my clientele last 18 to 24 months. Sometimes it really depends on the person. And again, on how much they're moving the tissue. Like I'm a very big talker. I use a lot of muscles around my mouth very frequently. And so for me, filler just doesn't last as long. But for somebody who maybe has a quieter desk job or their metabolism just doesn't run through things quite as quickly, it could definitely last much longer. I have seen it up to 2 years where I'm still like, nope, we don't need to touch that up. It looks good. Lip filler is a really great option for somebody who's just looking to create some volume, potentially get a little bit more definition to their shape. And up next, you're going to see one of our before and afters here at Sand Plastic Surgery. There's more options available on our website at sandplasticsurgery.com or on Instagram at Barbara Sand PA. You're welcome to take a look there as well. It was a pleasure talking to you.
Hi, I'm Dr. Sand, the owner and principal surgeon of Sand Plastic Surgery, and I'm going to be talking a little bit about a lip lift. So a lip lift is a surgical procedure which shortens the distance between the nose and the upper lip. For some patients, the distance between the nose and the upper lip can lengthen over time, or sometimes patients naturally have a longer length there. What that does is it creates a smaller upper lip if you have a longer length there, and also generally makes the face look out of balance. The process for performing a lip lift involves local anesthesia, a small incision at the base of the nose, and typically it involves a recovery of about a week or so. We have some sutures along the base of the nose that come out after about a week. The benefits of this procedure is that it's a permanent enhancement. There's a lifted appearance to the lip. It can actually make the entire face look more youthful just simply by improving the distance between the bottom of the nose and the upper aspect of the red lip. For this type of procedure, it'd be best for patients that are looking for a long-term treatment for their low lip volume, for a thin upper lip, or for patients with excessive length of the upper lip. Typically, we do measurements of the upper lip. An ideal lip length would be about 14 to 16 millimeters. A lot of patients that are typically undergoing this procedure would have lip lengths in the 20 to 25 millimeter length. And so usually we're excising out somewhere between 4 to 8 millimeters in order to achieve that lifted look. We have several before and after pictures available on our website, and you'll see those demonstrated here in just a moment. So in conclusion, we've talked about 3 different procedures for the lip. That would be the lip flip, which would involve Botox to help improve some lip body by relaxing the muscles around the lip. We talked about lip filler, which would involve adding hyaluronic acid to the lip body itself to help provide more volume. And then we also talked about lip lift, which would be a permanent enhancement to help improve the quality of the red lip, provide tooth show, and also shorten the distance between the nose and the upper lip. Each of these procedures has a different length of treatment. The Botox, you would typically see a couple months worth of improvement from that. Lip filler, typically we're talking 6 to 12 months in terms of improvement, depending on the type of filler that was used. And with the lip lift, this would be a permanent enhancement type of procedure. I would encourage those that are interested in these procedures to schedule a consultation with Sand Plastic Surgery in order to develop a personalized action plan for them, as some of these procedures may be combined in order to provide the optimal outcome. Thank you for watching.